Well, we're headed into an exciting era of enhanced differential diagnosis for thyroid nodules, an era when molecular diagnostics are going to help us with one of the remaining problems with thyroid nodule differential diagnosis, the cytologically indeterminate thyroid nodule. Currently, about 1 in 5 biopsies lead to such diagnoses of indeterminacy, and among those patients, probably a third prove to have thyroid cancer. Without further diagnostic certainty, most such patients are currently being advised to have surgery. There are 2 molecular diagnostic strategies that are being explored. The first is a thyroid cancer candidate gene approach to look for a set of genes known to be associated with thyroid cancer, BRAF, RET, PTC rearrangements, RAS mutations, and in the absence of any of those mutations, then feel more confident the nodule's benign. That approach has a theoretical limit of achieving a negative predictive value in the 85% range. And then the second approach is one of gene expression analysis, an approach that began with the profiling of almost 250,000 mRNA transcripts in nodules that were benign and malignant to identify genes over or underexpressed in benign nodules. So with this technique, the 142 genes that were ultimately selected as informative, the expression profiles for those 142 genes are employed in an indeterminate nodules biopsy material in order to try and prove that it's benign. And the negative predictive value of this testing appears to be 95 to 96%, akin to getting a benign cytologic diagnosis. And in fact, these tests are now entering clinical practice. So it's an exciting era when we're going to perhaps see fewer patients with indeterminate nodules having surgeries that at the end of the day they prove not to need.